Here's something that everyone gets wrong about health insurance in Australia. It's to do with tax and turning 30. So there are two ways that the government tries to get you to take out health insurance so that, ostensibly you're taking the load off Medicare. Whether that works, different story. Those two things are the Medicare Levy Surcharge, or the MLS as it's sometimes known, and the Lifetime Health Cover Loading, or LHC. Now, the Medicare Levy Surcharge is not the same as the Medicare Levy. Medicare Levy, everyone pays. It's a 2% tax. That's all it is. You look at your tax statement from last year, it'll be there. The Medicare Levy Surcharge is an additional tax of 1 to 1.5% that you will pay if you earn over around $100,000 per year, including superannuation, as a single person. It's about double that if you're in a couple or family. Those numbers change quite regularly, so that's not the exact number, but it's about that at the moment. If you don't have hospital cover. If you have hospital cover, you don't have to worry about this. It's done, it's sorted. You will not be, no matter how much you earn, you're not paying the Medicare Levy Surcharge. If you don't have hospital cover and you earn over this much, whether you're 16 or 60, you're paying this extra tax and it's on your whole income. So if you earn $100,000, it's an extra 1%, that's about $1,000. So you could probably get a basic or bronze policy for that much. That's the whole point. It's to try and get you to, instead of paying that tax, get hospital cover. The Lifetime Health Cover Loading is the 30-year-old one. They have nothing to do with tax. It's a totally different scheme, but everyone gets it confused. The LHC is when you turn 30, the year after actually, it's the year you turn 31, but once you're 30, every year that you don't have hospital cover, you will pay an extra 2% per year when you eventually do get health insurance. So if you wait until you're 40 years old to get hospital cover, and you haven't had it for 10 years since you've been 30, then you're going to be paying an extra 20% on that premium when you eventually get it. Now, this also applies to extras. So if you haven't had hospital cover throughout your entire 30s, but you do get extras, every year that extras policy is going to cost you 2% more. So you can get into a little bit of trouble there. Now, the good news is the LHC, that resets after 10 years. So if you get cover at 40, yeah, you're paying an extra 20% for it, but after 10 years, if you keep that cover the whole time, hospital cover, not extras, then it'll go away, which is great, which is super cool.